discussing about very interesting topic, and that is fibroid uterus. So many girls or ladies come up with the reports on sonography of fibroid uterus, and you start wondering whether the incidence of fibroids is increasing day by day. What are these fibroids? Hippocrates, who's called the father of modern medicine, 5,000 years ago called them as sclerometas. Virchow, the gynaecologist of the old time, labeled them as leiomyoma uterus. Fibroids are also called as myomas, fibromyomas, sclerometas, and lots of other names are also given to this fibroid. The incidence of fibroid is labeled as almost 10 to 15% in our textbooks. But let me tell you frankly, the incidence practically what we see is much more. It amounts to almost one woman in every fourth woman we see has fibroid uterus. What are actually these fibroids? These fibroids are nothing but benign neoplasms of the uterus arising from the myometrium. That is, it is a fibromuscular swelling or a neoplasm in the uterus. The fear is it cancerous? No, I used the word benign. It means it is a non-cancerous swelling of the uterus. Sometimes, as I said, it arises from the muscular part of the uterus, but sometimes it is also seen in the ligaments of the uterus. What are the ligaments? Ligaments are nothing but the supports of the uterus. Are these fibroids related to some hormones? Yes, definitely. Fibroids are known to be estrogen-dependent tumors. Why do we say so? Because the fibroid size or the problem or the occurrence of fibroids decreases as the age of the woman advances. So if there is an existing fibroid in the menopausal age, maybe it starts shrinking in size. What is the age at which they can occur? They can occur at any age, right from the time the girl starts her menarche till the age of menopause. Fibroids are seen in any and every age of the woman. What is the other hormone which is responsible for increasing the size of the fibroids? That is the progesterone hormone. Now, one more interesting point is, what are the other associated conditions with fibroid uterus? We can call them cousins of fibroid, just for the understanding's sake. Number one, follicular cysts. What are these follicular cysts? These are the cysts which come up under the influence of an anovulatory cycle. Now, excessive estrogen hormone, as we have seen, is responsible for fibroids. Similarly, excessive obesity leading to PCOD also would be associated with anovulatory cycle, and this would be correlated with association of fibroid uterus also. So interesting it is, isn't it? Second thing is endometrial hyperplasia, that is the layer of the uterus which goes on increasing in size in millimeters because of influence of estrogen hormone. The other associated conditions are, of course, endometrial carcinoma. It can be associated with endometriosis, and other thing is adenomyosis. So now you have understood it very well that one problem can lead to another problem, or there can be a coexistence of 3 to 4 problems together, the root cause of which could be one common thing, that is excessive estrogen hormone. Again, remember, we are boiling down the point to irregular lifestyle leading to increased number of estrogen receptors on the uterus. So that is probably the root cause of genesis of fibroids. Let us consider the different symptoms a girl can come with when she has fibroid uterus. She can have dysmenorrhea, that is painful menstruation. She can have menorrhagia, that means excessive or heavy menstruation. She can have metrorrhagia, that is in between the menstrual cycle she can have spotting, bleeding, etc. She can have pressure symptoms, And of course, the symptoms with which she will come to a doctor will depend not only on the size of the fibroid, but it will also depend on the location of the fibroid. Like say for example, if the fibroid is pedunculated and it is coming out of the mouth of the uterus in the cervix, maybe she can have leukorrhea, that is excessive white discharge, admixed with a blood staining of that discharge. If the uterus swelling or that fibroid is right on the anterior wall of the uterus, pressing on the bladder, then she can have difficulty in passing urine. She can have urinary retention or lot of other symptoms. So the point is, the symptoms depend on the size, the location of the fibroid. The fibroids are classified in different ways. The first one is a subserous fibroid. What can be a subserous? The one which is present on the surface of the uterus like a cap. Now this can have a stain with which it is stuck to the body of the uterus or to the myometrium from where it arises. Such myomas, when they are pedunculated, and if there are large fibroids like this, they can undergo torsion in the peduncle where it is attached, and that can create complication. Sometimes the fibroids are there in the muscle layer of the uterus. They are called intramural fibroids. They add to the bulk of the uterine tissue. Sometimes these fibroids pop out into the cavity of the uterus and they are called submucous fibroids. Submucous fibroids, they are small or large. They cause lot of menstrual problems. Sometimes these are the fibroids which can create problems during pregnancy. See, fibroid after all is a swelling in the uterus which is like a baby. But the only difference is it is unwanted. So the fibroid will definitely grow along with the growing pregnancy as the blood supply to the growing fetus is increased in pregnancy. That is why the size of the existing fibroids goes up in pregnancy, increases in pregnancy. In pregnancy, fibroids undergo a degenerative process that is called red degeneration of fibroid. And in pregnancy, if there is a lot of pain and if there is fever and if there are other problems in pregnancy, one must go to the doctor immediately and find out about what is happening to this existing fibroid in pregnancy. When a person or when a patient or a woman comes to the doctor with any particular symptoms, we always do a clinical examination first. And on clinical examination, if there is suspicion of something, we always send the patient for a sonography. Now with an advanced sonography technique nowadays, we can map the fibroids on the uterus. What is it? If there are fibroids or even multiple fibroids, the experienced sonologist maps on the uterus actual location of where it is present. Like we have Google Maps giving our location, the modern sonography map gives the location of the fibroids, exactly where they are and what are the likely problems you can come up with those fibroids. The management of fibroid depends on what is the age of the patient. If it is a very young girl, obviously one would not like to go ahead immediately with a surgical intervention or with the removal of uterus. So one always likes to have a conservative management first. But if the bleeding is too much, if the hemoglobin level is going down because of excessive menorrhagia, then one must intervene. If it is a reproductive age group and if the fibroid you feel is submucous, it comes in the way of implantation of the fetus or the embryo, then yes, then it becomes mandatory to go ahead with a surgical management in the form of removing the fibroid, and that is called myomectomy. Suppose a girl or a lady comes to you in the menopausal age group She has finished with her childbearing and there is no need of a child again in her life. She has finished with everything, but the problem of bleeding is too much, or if the problem of pain is too much, then you can advise her removal of the uterus. So removal of the uterus is termed as hysterectomy. So I always tell all the patients that if the trouble does not trouble you, there is no need of troubling the trouble. So the point is clear. Fibroids can be asymptomatic. Remember, mere presence of fibroids on the uterus does not necessitate the treatment. Sometimes the lady comes to us with a size of fibroid like say sub-centimeter or maybe 1 or 2 centimeter fibroid, which otherwise is not interfering with any of her either reproductive or menstrual functions. There is no need to intervene. But if the fibroids are symptomatic, then even if the girl is unmarried, sometimes we are forced to go ahead with the procedure of myomectomy. That is, removing only the fibroid without even injuring the uterus. Unless you take care of the root cause, the increasing size of the fibroid cannot be prevented. And what is that root cause? We have discussed, remember? We have discussed about increased estrogen support. Where does that come from? It comes because of our long lifestyle. It comes because of obesity. So not all the patients of fibroids will have these problems. But at least in those who have these problems, that can be tackled very well by taking care of our lifestyle. So why not focus on a good lifestyle, which comprises of not only good diet, not only exercise, not only taking care of stress and the other factors, but also important is taking care of your mind and emotions.